Okay, so mwalimu wako fide ati omuntu alwere fy'omutwe ero afwa. Aba alwere fy'omutwe bali fye bwino bali angala fye bwino ero baisafu. So today let's talk about what an headache is, or let's talk about what headache is. So the clinical evaluation and management of headache. Okay, so ukulwala omutwe kwali popo more complicated than we think. Kadi mwana fati nga walwala omutwe kuno wafika panadol nishwapola nolo wanafya mishwapola. The cause of your headache can be a detrimental thing if you do not go to the hospital, if you do not understand a field way. Okay, so ukulwala omutwe nolo muchisungu futu that headache can come as a primary thing or as a result of something, a secondary etiology. Katopunda etiology tepunda tifile causinga. So a primary headache, this is just a benign headache, recurrent condition without any underlying structural disease. Tapadi disease immi irerenga olwale fidi ochitererani kani. So it's the prevalence about over 90% of primary care presentation. Abantu about 90% ngabayeza ku hospital balasa present nomuntu okalipa. Okay, so the primary headaches can be a migraine, a tension type, or a cluster headache. To discuss ukuya kuntanshi. Okay, and the primary ones can be as a result of functional neurovascular dysfunction. Okay, now the secondary ones are the most dangerous ones. The secondary headaches are the most dangerous ones. So these are the type of headaches caused by underlying organic or systemic pathology. Okay, and the prevalence is not that big. It happens in a minority of cases, but it has got a high morbidity potential. And upon that morbidity potential, they put that bala for when your headache is secondary to something. So secondary headaches can be caused by an infection, can come as a result of hemorrhage, can come as a result of a tumor or vascular lesion. Okay, it happens when there is structural retraction, inflammation, or raised intracranial pressure, as you can see from here, or raised intracranial pressure. Okay, so let's go to the next slide. When you are taking history or let me say when you go to the hospital, there are certain things the doctor is supposed to ask you. Could you go hospital? No, imumwe bari yako hospital from vile mwachita understand is that the first thing the doctor is going to ask you is the type of an headache you have. What are the characteristics of that headache? Did it come as a thunderclap or it had a gradual onset? What's the duration of those attacks? The frequencies, how many months has it been happening? The episode versus that will help us to look at if it's an acute headache or a chronic, given a chronic trajectory. And then the type of pain you're having, that is number 2. The pain quality, let's zoom in. The pain quality, unilateral versus bilateral. Is it throbbing, is it pressing, is it band-like, or is it stabbing, or the second severity? Okay, so, and then the other thing is, what are the associated features? So kuli fufoba sangoma hospital, as who are found in the hospital, who know what is causing the headache, who know if it is a secondary headache or a primary one. Okay, so self-medication is the most dangerous thing that can ever happen to you. Self-medication and self-treatment. Maybe no, there are more complications. Having an headache is a complex thing that needs a medical professional or a medical personnel to see you. So in the next video,